All right, we've got Dr. Ezike back. We apologize for the audio issue. Thank you, doctor. Let's get right back to it now. And that question of whether or not cases are leveling off in Illinois, are you optimistic we're starting to turn that corner?
I am cautiously optimistic that we are. So we are seeing the test positivity go down, and that's one of the earliest signs that we're heading in the right direction. If you have lower test positivity, that should turn into lower cases, which means less people going into the hospital and, of course, less deaths.
I'm so glad that we can hear you now because you've got so many smart things to say. So good to our technical people for getting it working. I do want to ask you about some of our Black and Latino communities. I've been tracking the numbers and the zip codes for the last probably 9 months, and I continue to see the same neighborhoods with the high number of positive cases of the virus. And I'm wondering, it seems like the vaccinations are not keeping up with those numbers. So I'm wondering, how critical is it that that message gets out of how important the vaccinations are?
That message is critical. And as you appropriately and correctly said, there's a little bit of gap or disparity between the proportion of Latinos and Blacks in the population versus the amount of vaccine that they've gotten. And so we've been working so intentionally under the leadership of Governor J.B. Pritzker, who is an equity champion, to make sure that we keep narrowing these gaps. I know we're doing much better than other big states, but we want to keep pushing ahead.
Is the state forecasting kind of the point when you've vaccinated as many people as are willing to get vaccinated? We're at more than 50% of the people have had at least one shot. How high of a percentage do you think we're going to get? And is that good enough to snuff out this virus?
Yeah, we want to snuff out this virus, and to do that for sure, 100% would be great. I know it might be hard to reach that, so we're just going to keep pushing. There is no point at which we give up on vaccinations, if you will. We have all kinds of new innovative strategies that we're implementing with our pediatricians, with our hospitals, with our clinics, with our community partners, with ethnic and religious organizations. So there are many levers that we're still pulling to make sure that this message gets out to everyone and that vaccine gets in everyone's arm.
Yeah, keeping the ideas going. I want you to sort of give us your forecast on where you see this virus going a year from now. Where do you think we'll be in the summer of 2022? Life post the pandemic, how we'll tackle the virus in the years to come. Give us your thoughts on that.
So Lourdes, my crystal ball is not functioning right now, but if I'm able to just use my best guess, I'm really hoping that we will have put this well behind us, and that even if there are new variants of concern that threaten even the vaccinations we have, that I know that these amazing pharmaceutical companies are already ready, looking ahead to what might be needed next. But hopefully this next summer 2022, will be even better than a good summer 2021.
We just have about 30 seconds left. 78% of people 65 and older are now vaccinated. At what point are we kind of, okay, we've protected the folks most at risk, let's open Illinois back up again? I mean, I know you hear that every single day.
No, we had these metrics that we're moving, that we were going to use to move into that bridge phase. So as we get the hospitalizations down and the number of people going into the hospital going down, the other metrics are starting to look good. So if those can get under control, we'll go into the bridge phase. That has some more opening. If we stay good for another 28 days, then we can go even into that phase 5. So I think the horizon looks bright, but we all have to keep our masks. Get someone else vaccinated if you've already been vaccinated. Each one get 10 more people to get vaccinated, and we'll get there quicker.
Just got mine on Tuesday, my second dose, so ready to go.
Wonderful.
Thank you so much. Dr. Ngozi Ezike, we appreciate your time here with us.
Thanks so much for having me.
Have a good afternoon.